This Functionised Podcast is brought to you by Functionised Integrative Therapeutics, home of the once-in-a-lifetime Fit Lab. Also now home to the Fit Clinic. Become a better version of yourself each and every day through Functionised Integrative Therapeutics. Visit www.functionised.com. Check us out on Instagram, Facebook, at Functionised. That's Functionised. Live Functionised.
Today we are thrilled to introduce Dr. Diana Martinez. Not only is she a medical doctor, but also a PhD. She is with a specialty in neurorehabilitation. We are thrilled to have this opportunity to work with somebody that has such experience in neurofeedback, working on conditions with sleep disorders, TBI, epilepsy. She's the director for several organizations and the co-founder of Boston Neurodynamics. We are excited to welcome Dr. Martinez today.
Thank you. Thank you very much for having me.
Thank you so much for being here. It's an honor to have you here on our podcast today. Let's get into it. We've got a lot to talk about. Everything that you've been doing is really exciting and goes hand in hand with a lot what we've been doing over at Functionised as well.
Yeah, sure. Happy to share.
So I know that you spend a lot of your focus on neurorehabilitation. So Would you mind explaining to us and to our listeners what that entails and types of conditions that you work with?
Yes. Yeah, my background is I had a training as an MD and back in Mexico. And I was doing my part of my residency in emergency room. And we were really amazed how many people survive severe conditions. So more people were surviving accidents and cardiovascular issues that before we really didn't have the tools and the technology to save so many lives. And all these people were surviving, but the condition afterwards was pretty bad. And when you were looking into the rehab area of helping these people to get back to life, it was very, very limited, the opportunities that have these people to rehabilitate some functions. So this is when we got very interested in this area in the field of neurorehab, and we came to Philadelphia and to follow a fellowship in neurorehabilitation. And in this particular fellowship, we were finding and creating different programs and stimulation techniques that can help different conditions from adults and childhood to help to improve function. And at the moment I was working with a neurologist epileptologist, as many of these conditions has, on top of whatever condition they were having, on top of that, they were having seizures. And even with all the stimulation and physical therapy, occupational therapy, speech therapy, seizures were really on the way to help the brain to develop. So we were trying to think for a non-pharmacological intervention that could help to reduce seizures. And of course, we were looking to the nutrition, to the supplements, to all these non-pharmacological approaches. And we found in that way neurofeedback. And we were very curious. We read about it. It makes sense for us for all the neurophysiological bases that neurofeedback has, and we wanted to learn it. So we went and we reached Barry Sterman, one of the founders of the neurofeedback field, and he actually told us everything from the basis, and we train ourselves and we start applying in these conditions. Our first patient was a patient that survived a traumatic brain injury after a car accident. And it was really severe, the seizures that were really affecting his development or his progress. So we started using neurofeedback on him, and it was really impressive. Not only how the seizures were more regulated, either in seizure frequency or intensity or severity, but also how other functions were improving. And this makes sense for us because once you regulate the hyperactivity networks that cause the seizures, that this is like a dysregulated area of the cortex that is just messing up the rest of the cortical functions. When we were able to regulate that part, we could see how the other areas of the brain were able to develop thanks to the other stimulation interventions. So I was very, very intrigued to learn more. So this is why I decided to go ahead and do my PhD, where I proposed to study the effect of neurofeedback in epilepsy. And that took me several years to to complete that PhD. It was an amazing challenge, but I definitely helped me a lot to understand the underlying mechanisms of neurofeedback and epilepsy and how we can help this population.
Now, if there's a patient that needs neurofeedback, in your opinion, I mean, we see patients and clients on a daily basis, and when you see that neurofeedback may be the modality for them, explaining to them is not always the easiest because they're not always familiar with it. So if you see a patient that you feel is the best treatment for it, how would you explain it to them in order for them to pursue this?
Yes, this is one of our biggest challenges, right? And when we think about how we can share this information, it's not like selling shoes or selling food that everybody have the experience of using shoes and how they look like and what they are for. And explaining neurofeedback is such a deep concept and few people has experienced it. So it's really difficult to share it in an individual basis. So basically what I explain the people of my patients is neurofeedback. It's a learning procedure. It's a self-regulatory training where you will learn to organize your brain so your brain can function better. And the way we do that is, depending on your approach, we will try to localize where the areas of the circuits that we think or we find that needs to be improved, and we will decide the exact frequencies and the exact brain waves that needs to be balanced. And you will be sitting in front of a screen and you will be wearing sensors on your head. And every time your brain understands what is the balance of these brain waves, you will receive a feedback. The feedback hopefully has 2 or more sensory pathways, could be auditory, visual, tactile pathway, but we need to tell the brain and your system that every time you reach this balance, you are receiving the feedback. So the brain by itself really likes this feedback and understand it way faster than we actually do, and the brain likes it and wants to keep trying it more and more. So this is the way your neural circuit is training to be balanced and be more functional. So I know some people like to use the word video games or something that can be more people understand better. So sometimes I use the word video games. I try not to because it's not a video game. Mm-hmm. It's way more complex than that. But of course, for children, if I'm explaining to a kid, I will use the word video game, right? So they could relate to that and say, yes, you will be playing a video game. Instead of using a controller, your brain will be the controller. And every time your brain, it's better, smarter, or whatever the purpose of the training is, and you will see the video game moving or scoring or going forward. So for the kids, I feel that it's easier to explain, and actually they get it pretty fast. For the adults are the ones that get a little bit more trickier. But I think when they understand that it's learning because it's a training, right? It's training the neural circuits, and they understand the term of self-modulation, that it's their brain by itself finding the balance. I think that's a concept that it's easy to get and understand.
You mentioned children, and one of the things that we have done presentations on are natural ways to work and help with ADHD symptoms. Yes. And through a lot of research, I know neurofeedback is an excellent approach that can help reduce the symptoms of those with ADHD.
Oh, yes, absolutely. ADHD, it's a condition that has been studied the most, of course, because it's a condition that we see very often. And we have limited therapeutic approaches, right? We were really, really stuck into the pharmacological intervention. And we know that making the diagnosis of ADHD can be very easy to misdiagnose ADHD, because to fulfill the full criteria of ADHD, it's hard. But if you have 2 or 3 criteria and the parents are desperate and the teacher won't have this kid at school if he's not medicated, of course, all the system is pushing this kid to be on medication. But thankfully, we have these approaches where doing this training, organizing the circuits that are related with attention, in hyperactivity, that are the main symptoms of ADHD, the brain learns how to regulate and modulate these symptoms and actually improve significantly. And this brain was never under the effect of a medication, of a drug. That unfortunately, the effect of the medications is just temporary, right? The effect can be beneficial just for the period of time that this brain has the chemical impact of the drug. But once you remove it, the brain is back to the baseline issue. So we are not really fixing the root of the problem. So what we like about neurofeedback is that we are going to the root. We're finding this network. We're going to organize the network from scratch. So hopefully the intervention will help to get it in a level of function that it doesn't need any other drug, and hopefully it doesn't drag many other issues during developing, right, during childhood, if it's a kid that we're helping. So it's a very good intervention. We have a lot of research to back up and clinical experience. I think most of the clinicians that are doing neurofeedback have been treating ADHD successfully.
And that's one of the nice things about it, because you mentioned, training the brain, so it sets them up for long-lasting results.
Yes, absolutely, because learning, it's a skill that once we learn it, we don't forget it, right? And I like to use very often the example of when we learn how to ride a bike, right? Mm-hmm. And most of the neurofeedback practitioners use that example. And yes, the first time we learned to ride a bike, we fall several times. It was hard to find the balance. But once we learn it, this is a skill that was like really deep in our memory motor skills. And even that we stopped riding a bike for 10 years, when you get into a bike, it won't take you as long as bad like 10 years ago when you first started. So the effects of learning are long lasting, as it has to be the benefits for long term.
Do you find that with any type of supplementation or even medication that it assists neurofeedback along, or do you feel that neurofeedback typically has been shown on its own to be more effective than even with a supplement to go along with it?
Yeah, that's a great question. In our approach, we always try to educate our patients in terms of nutrition and supplements. And there are basic nutrients that we definitely encourage people to take, like the bases, like omega-3s are like every single brain should be taking omega-3s mm-hmm. because it's a nutrient and a fatty acid that our brain, our retina needs, and we don't consume it in a good amounts in our regular diet. So there are like nutrients that every person will need to take it, regardless you are doing neurofeedback or not. Of course, if you are doing neurofeedback for more reasons, because you want to have like a good nutrition from these neurons, so you can actually modify their function. And individually, depending on the conditions, we can address different supplements. But talking about medication, that is a great question. The common sense is, hopefully we could have a brain that is not having any medication, so we don't have any chemicals in our pathway to help these neurons and circuits to learn to self-regulate. And this is in the ideal world, right? Ideally, we will prefer to have brains that are clean and there's anything interfering. But this is unfortunately not our everyday case. And most of our cases will have medications, and neurofeedback is not a contraindication when the patient is taking medication. But we need to make it the statement that maybe the effects of the neurofeedback could be a little bit slower because of the medication. It's making some chemical changes. This is in general cases. Some cases that can be more complex or more severe. There is a kid that there's no way he will stay sitting and with electrodes on his scalp and sitting for 20-30 minutes, and there's no way he could cooperate that. Of course, they will need to be medicated to even start doing the training, right, and have some cooperation from them. And yes, there are some particular cases that the combination of the medication with neurofeedback could be beneficial, right? They can co-activate, so the neurofeedback can help the medication to be more effective. So it has to be very individual evaluated, so every case needs to have specific indications, but these are the general assumptions.
That's fantastic. In addition to the epilepsy and ADHD, more research is coming out on the use of neurofeedback for post-concussion syndrome as well, and
Yes.
helping to reduce the severity and the length that people are experiencing those symptoms. Have you been able to work with those that are coming in for post-concussion?
Oh yes, now it's a hot topic and many people is calling in for these cases, and it's because we have more information and we are learning more about the impacts on concussion. Before we were thinking that it needed to be something severe, that you lost consciousness and that you have effects, immediately effects after a concussion, and of course, you needed to go through all the medical procedures or have a specific testing to evaluate how was the brain functioning, or at least how was the brain structure. But unfortunately, most of these medical testing, it doesn't show anything evident, right? Anything that we can actually measure and test, because the post-concussion syndrome is more into the functional level, and many times cannot be captured in that medical testing. In our office in particular, we use the quantitative electroencephalograph, the QEEG. Mm-hmm. So basically it's an electroencephalograph, and we do a quantitative analysis, and we reproduce a brain map. And this is purely measuring function of the cortex. And with this type of testing, we can really get accurate information of identify what are the circuits that could be affected because of the concussion and can be related with the symptoms that the person is experiencing, from confusion, fogginess, attention issues, depression, sleep issues. And all these, of course, started to develop after the concussion, even that didn't look that severe, and is because of all the inflammatory processing that is happening in the brain. And neurofeedback can be a very effective technique and training to help these networks that were hurt during the concussion, so we can help them to be restructured and functional way faster than just giving the normal time or natural healing of the concussion, if there is so, right? Because now we know that there are long-lasting, long effects after the concussion, after years, right? That can be a consequence of this the concussion. So there is a lot of information, research, more tools, and more education, that the public is more aware of taking this seriously and being aware that there are techniques that can be helpful.
That's Wonderful. You mentioned the concept of neuroplasticity.
Yes.
And I know what neuroplasticity is. Jim knows what neuroplasticity is. But it's kind of a hard concept for a lot of people to understand that the brain is fully capable of changing.
Yes. Yes. And it's hard to understand because it's pretty new. Mm-hmm. Or at least that made me feel old, because when I finished med school, and I remember my last year of med school, we still didn't understand the concept of neuroplasticity. The concept was the neuron that died is dead. That's it, right? So you will lose neurons over time, and this is not anything that could be changed. And this really started changing pretty fast, thanks God, through the years. So we now fully understand that we actually have the capability to regenerate neurons, regenerate circuits, synapses, connections, and this happened thanks to learning, right? Learning procedures, different type of learnings that our brain is capable of. And really the easiest way to understand it is, before we were like, okay, if I'm going to learn any language or playing any instrument, I have to do it when I was a child. When I am an adult, I don't think it's possible. My brain is too old to learn new things. And now we understand that no, our brain is still very capable of learning and having new skills and really modifying new networks, and we have full capability. Yes, it's different, the neuroplasticity that we have as an adult that when we had as a kid. Definitely it's different, but it's still happening, right? So if you are an adult, an elderly person, and you can learn anything, this is your best proof to show that there is neuroplasticity, right? So you are learning new skills, learning is happening, your brain is changing. So now we know more and more that engaging adults' brain in learning new skills, languages, instruments, sports, whatever skill, it will be helpful for our normal aging stages, right, for our brain. So yeah, it's fascinating.
What are some of the other modalities that you like to incorporate that are non-invasive that can help improve performance?
Yes, well, something that we use every day and is very well known and very well used in clinics and other spaces are biofeedback techniques, right? Periphery biofeedback training. In the neurofeedback, we basically go straight forward and train the brain activity. In biofeedback, we train the body functions, right? So we are able to train to learn how to take control or to modify our heart rate, following with our respiration, our muscle tension, skin conductance, temperature. These are automatic functions that our brain has, our system has the capability to regulate those, right? We're not thinking constantly how fast my heart beats or how slow or how fast my gut moves or how tense I need to be sitting in this position. This is something that happens automatically. But we can train all these functions with the purpose of improved function and any really specific function. So, for example, it's very commonly used for mood regulation, anxiety, depression, to train heart rate variability. That is a training combining the breathing and the heart rate with extremely easy to do. Well, for people, it looks very simple, but once you have the tools and you understand how to do this breathing in a regulatory modality that your heart rate can follow your breathing, you will find the benefits of regulating your automatic nervous system and can have control of the overwhelming responses to stress. Like when we get stressed, our heart rate is very fast, our muscle tension, our muscles get very tense, our temperature drops, and we have tools to regulate that, to being a better regulatory space in our body. And once we have more control, we can function better. We can make a better decision. We can perform better. We can have a better movement if we are thinking about sports. So really, it's a very great tools, simple tools that are very effective to improve performance and other functions. This is in the biofeedback, but we have another range of techniques that many of them were still in research. Some of them being in use in clinical approaches, like are more into the neuromodulatory area, where you actually apply certain currents to the brain. It could be electrical current, magnetic current, either to the brain, directly to the brain, or to the periphery, to the nerves, to the vagus nerve, the trigeminal nerve, that are active current that you apply to the nerves or to the brain to help for the main purpose of self-regulatory process and improve functioning. So yes, it's a whole other world that we're seeing is happening.
That's definitely my area of focus, is the heart rate variability. I have seen, and I use it on myself and with a few people that I work with, and it's amazing to see how their dispositions change, learning how to manage their everyday stressors, and their work performance improves, their sleeping improves. They're not as stressed when they're dealing with their children, right?
Exactly.
Yeah, no, it's really amazing. I tell my patients, it's like give you a gift, like almost like a free gift, because once I find the strategies to balance their physiology in the office with the training, they can do it outside of the office anywhere. Mm-hmm. And it's just really a gift, because you have now tools. Instead of just exploding and just making your body pay all for it, you have tools to help your body to be in this balanced state, so you can self-regulate. And yes, you won't explode as often. Life is very stressful, and we could explode every 5 minutes. So if we don't have these tools, really our health is getting impaired. And of course, this is why we develop all these conditions: high blood pressure, migraines, sleep issues, and pain, headache. So it's a lot of chronic exposition to the stress response from our body. So it's an amazing tool that hopefully more clinicians learn how to use it, and people have more access to it.
Absolutely.
Quick little, we did a case study actually a couple weeks ago.
Yes, that was
fun.
And
we had a local physician who specializes in acupuncture, and he was hitting a bunch of trigger points on me, and Chantea had been monitoring my heart rate the entire time and utilizing heart rate variability, biofeedback on me, and just watching me go from such a high level of stress and pain as he's hitting these trigger points and feeling the twitching, and walking me through the breathing, how it regulated more and more and more. And it was an amazing experience to actually go through that acute state, seeing something that happens in the right then and there, because most people don't see it happen overnight. It takes time.
Yeah. No, it's really amazing. And what I love about this type of training, I like to tell to the patients, is the screen is your mirror, your physiological mirror, right? Mm-hmm. So you are looking to your physiology right there. So you can see in real time how your body is stressed, or how you find abilities to calm down, and what it works and what it doesn't work. So it's really amazing how to have access to that mirror and learn how your body works and what do you need to get where you want to be. So it's a really great tool. And I don't know if I have time to give you also like an example of why we start using it. My brother, he works in finances, and I went to visit him to his office, and he was working with the market, the stock market, whatever. So he needed to make a decision where to sell or buy, whatever they do in that market, and all the office was screaming at him, buy now, buy now. And my brother was like, no, no, I need to hold on. And I could see his body. I was looking to his body. I could see his pulse here. He was all red. He was sweaty. He was shaking. I could see how his eyes were about to explode. And he needed to make this decision under this type of pressure. And then finally he said, okay, let's buy now. And they make the movement. And then it was a good movement for him. And he was like, well, depending on when I say we buy, I make my client making $10 million or lose $10 million or whatever. And I was looking at him and I was like, how many times a day you do this? Now, how many times a day you are in this stressor moment? And he was like, well, this is what I do most of the day. And I say, I love you, but you won't survive after 50. You will be there. You are putting your body in such a stressful moments. I could see how your body is, and he was telling me all his other issues. I have gastritis, I have issues, I don't sleep, I have pain, whatever. So then I told him, bring me your 5 higher executives and yourself, and we will do a protocol of HRV and neurofeedback. So we went to his office and we were doing all this training every morning. Before they went into their office, they came to the training office and they did this training. And after 20 sessions, of course, we remap, we measured the heart rate measurements and all that were a lot better. But I wanted to have their subjective experience. And they were amazed of how much better, more regulated they were when they needed to make this type of decisions. They didn't feel their body was about to pass out. So because they were more regulated, they could make better decisions. They actually allowed their brain to make the better decision instead of just the body just taking over, right? And just rushing to whatever decision they needed to make. So they were like, we are improving our results here just because of us making better decisions. And they were telling me the side stories. They said that they play golf just to relax. And they say, we were the worst. We never played to see who was the best. Here was just to relax. And all of a sudden, we start becoming very good golf players. And it's not because we were training more or because we care more. And I said, what happened? I said, I don't know. We were just a lot more relaxed. We could make better decisions when we were about to hit the ball. And it was really amazing how we could see this. It didn't happen in months. It was 20 sessions almost back to back in 2-3 weeks. So you could see the effects in other areas of your life, or how having these skills of self-regulation, your brain can be focused, make better decisions, be calmer, and be more functional. So I love this example.
That's a really wonderful story of true peak performance training without necessarily specific training, and how the body, when it's in that proper state, every aspect seems to flourish.
I find so many elite athletes, top-notch business executives will undergo biofeedback training, they'll undergo neurofeedback training, and they just perform better. But a lot of times it seems like the general public, they just don't want to have anything to do with it. And that part I just can't get. And do you find that happens as well? It's mostly individuals that just they want to perform.
Yes, I think as you mentioned, you won't get stress with your kids, right? Just regular people. We have stressor all the times going on, and our life can be very difficult if we don't have tools to regulate. And more when being parent, I'm going to talk a little bit parenting, that it's very stressful these days to be parent, and how we need to be the best models for the kids. And of course, if we lose it all the time, there's no way we can help these kids. So I think many times the parents bring the kid because the kid is the one that has behavioral issues and emotional issues. But when we look to the parent, and we're like, I think we need to start from the other side, because it's really let's our kids are our mirror as well. As bad or as good as we are, our kids are going to show off what is going on. And really, we don't get the help that we need. It's very hard to help the kids to develop in a healthy emotional way.
I think that's a really, really strong point, that it does start from the top, and we should be, the role models for our children. And I'm a big believer in self-care, and that, in order to help take care of those around you, you have to start with yourself.
With yourself. And it's hard because, yes, we are willing to pay anything from our kids, right? Like, we don't care how much will cost us. We want the best for our kids, but we don't spend money of us. And we really need to be in that state to be transparent in past this very important emotional learning that we are teaching every day to our kids. So I will see it as an investment for your kid as well when you take care of yourself, because everything you are showing or behaving, your kid will get it as it is. So very important to be in both parts.
Absolutely. Well,
Yeah.
if others want to find you on the web, on your social media, get in contact with you if they have questions, how can they do so?
Yeah, sure. Visit our website, www.bostonneurodynamics.com. We have a clinic in Boston area where we offer neurofeedback training and biofeedback, and we are big in QEEG brain evaluations. We are trying to spread the word that even if you are not that interested in getting all the training, at least you can see how your brain is functioning. So you can have an idea of where you are and see if you need other type of help or not. And it's just like now everybody's very interested in having the genetic testing and learn about their ancestors. I think it's very interesting to learn how your brain is functioning and take a look to that window of how we can do to improve. So yeah, we'll do all these services. Hopefully somebody contact us.
And so if anyone's in Boston or the Massachusetts area or wants to get an airplane and fly into Logan,
yes,
you can go see you. Absolutely.
Yes, great. Welcome here.
Absolutely. It's so important, as you said, just to know how your brain functions. 'Cause
Yes.
It's the only one you have, right?
Exactly. And we better take care of it.
Exactly.
Well, I love what you're doing up there and all the work and the research that you're putting out. It's a great addition to the psychophysiology profession. And, I'm happy that you were able to spend some time with us today and just help to educate others about the wonderful benefits of neurofeedback. So thank you so much.
Yes, and congratulations to you both. You are doing a great, great job. Hopefully more people hear about it and more clinicians get interested and hopefully more people, have access to it.
Absolutely.
So let's keep going. Thank you very much.
Thank you so much, Dr.
Thank
Martinez,
you.
for being here.
Take care.
Beauty Brains Brawn,
I am out.
Mad Scientist, I am out.